Welcome to the Causes or Cures podcast, your gateway to understanding health and groundbreaking medical research in a fun and easy to understand way. With Dr. Eeks as your host, join us as we sit down with the world's leading doctors and scientists to unravel the mysteries of health. From practical tips on well-being to the latest breakthroughs in medical research, we cover it all. Don't forget to subscribe. Now, let's ignite our curiosity and together dive into today's episode.
Hello, and thanks for joining in for this episode of Causes or Cures. I'm Dr. Eeks, your host, and I hope you all are doing well out there and staying healthy. Okay, so you all know or have an idea about how good a dog's sense of smell is, right? And we're going to hear more about that in today's episode. But a dog's sense of smell is so good that it is being used to detect illnesses. And this is before a doctor can make a diagnosis even. If you are a regular listener of Causes or Cures, and I hope you are, if you're not, consider subscribing. But if you are, you'll know that in the past, I interviewed Dr. Mandy Gula about how they are training and using dogs to detect Parkinson's disease. And that is a really cool episode. So if you want, you can listen to that one. It's episode 125. And today's episode is equally fascinating. My guests today are Dr. Simone Gadbois and Laura Kiiroja, and they are going to talk about their research on dogs detecting stress, the sense of stress, if you will. And this is in people with a history of trauma. So for example, people with PTSD, war veterans who may have PTSD. And there are certainly a lot of people out there struggling with PTSD from whatever trauma they may have experienced. The focus here is, can a dog detect a scent for stress in those people? We are going to hear all about that, how they did the research, where this research is heading, and the broader potential practical uses of this research. All right, so let's connect to Simone and Laura and hear more about this work. 1 second here, guys. When New York City had an earthquake not too long ago, which was completely unexpected, I was recording a podcast with this researcher in Syria, and I'm just sitting there like, what was that? I might explode during this podcast, which would make for good
sometimes I have to explain ducks in the background.
Ducks?
Because yes, I have ducks, pet ducks. And
you do?
Yeah, during the winter, they may sometimes be in the house if it's really, really, really windy and everything outside. So sometimes we get interrupted by ducks and people go, what was that?
I love that. I'm a big duck fan. That's great.
Oh, well, there you go.
Yeah.
Great club.
All right. Okay. So let's jump in. We're going to talk about scent detection dogs and a great study that caught my attention that you both did involving post-traumatic stress and stress. But first, thank you for being here. And do you mind just taking a few minutes, each of you, to kind of introduce yourselves and tell our listeners the work that you do? Whoever wants to go first, go for it.
Sure. So my name is Laura Kiiroja. That's the correct pronunciation. I'm Dr. Gadbois' PhD student. I did my PhD at Dalhousie University in Canada, just defended recently. And now I'm back in my home country, Estonia, so international PhD student at Dal. And yes, this study that we're talking about today was my PhD study, the empirical part of it.
Awesome. Thanks.
My name is Simone Gadbois. I actually started as a wolf researcher for my PhD, and then find myself studying olfaction in dogs. And the lab has 2 research programs, one on wildlife conservation canines, where I feel very at home, meaning in the field, doing research on other species at risk. And this program, which I usually involve PhD students in, or graduate students in general, which is the biomedical alert and detection. And we've had 2 sub projects under that umbrella over the years. One about detecting hypoglycemia. Initially, it was thinking about nocturnal hypoglycemia in children. And then this one that Laura has worked on for the last 6 years.
Awesome. So how big is the canine olfaction lab? How long has that been around for?
2006 technically, but it really started moving quickly around 2009 in terms of bigger projects, grants, contracts, etc. In a sense, I was using my very first dog, Kafka, back in the 90s, actually, to find coyote and red fox dens for a project, not realizing at the time that there was anything particularly special about this, or that people were actually going to go mad on this idea of doing research with those dogs later. And it's fox dens are really easy to find, by the way, but not coyote dens. Coyotes are ghosts in a sense, and Kafka kept finding them for me. And it's something I figured out in the field totally by coincidence. One day I was having lunch. It was noise behind me. I look, and there you go. There's baby coyotes coming out of a den. And Kafka looked at me and went like, why are you so excited about this? And you want me to find those things? I'll find them for you. And that's, one of those things that happen sometimes in field conditions, where then she would find coyote dens for me. There you go.
And then you sort of honed your interest into the scent,
Well,
the canine scent, or?
Yeah, and I paused that for a while because at the time I was working with wild canids, including wolves, and that was not really, I mean, I was interested in pheromones and social communication. It was not really part of my PhD though, but I was observing this daily in the field, so I, developed an interest in this. So in 2007, when we lost the Canadian Centre for Research, where I was doing a lot of my research, I had to come up with something different, and that's why I thought dog olfaction, let's do this. And that's a story. Yeah.
Laura, what about you? What made you interested in this?
Similarly to Simone, I also have a wolf background. So for my master's and between my master's and my PhD, I studied wolves and I worked with socialized captive wolves. And I was I knew that I want to do a PhD. When I was looking for places to do it, for universities to do it, I looked for supervisors that would also, be interested in wolves. And my goal was to either study wolf behavior or dog behavior. And Simon was kind of ticked both boxes in that he did dog research and also had a history of wolf research. So yes, that's how I got in contact with him. Yeah.
Wolves. I love wolves. I've never did any research on them, but they fascinate me. Okay, so scent detection dogs. Would you mind giving our listeners a general overview of how they are used in healthcare or have been used?
Sure. Well, there are several applications for scent detection dogs in healthcare. What are more known, I guess, are cancer detection dogs or diagnostic purposes. For mostly cancer is what people have heard of more, but also alert dogs, such as hypoglycemia alert dogs. So our study was unique in a sense that it was investigating whether dogs could detect psychiatric health conditions or mental health conditions. So yes, I hope that answered your question.
Yeah. Can I add a little something on this? It's maybe an academic distinction, but one that's important to me. Laura is totally right about this, that some of these dogs do diagnosis for cancer, for instance. We know now that I believe it's prostate cancer. I think their accuracy is amazing, much higher than for any of the current techniques we have. I think breast cancer, also some lung cancer types, they've been very good with. Cervical cancer, I think, relatively promising as well. But again, sometimes it depends on the groups that do the research. I think it has a lot to do with maybe what kind of training they're doing, what kind of testing they're doing, all these things. But there is a big difference between diagnostic and what really interests me here, which is the alert part. Because here, what the dog does is actually work with typically one person, at least in principle, and detect a change in a state, in a physiological state, right? It's very different from diagnostic, where you present one sample, say, is there cancer there? Yes or no, kind of thing. So it has its own challenges. And actually, part of what gets me really interested in this, I will bring this back to wolves, is that to me, it makes sense that a carnivore, a predator like a wolf, would be able to detect hypoglycemic or blood glucose changes in a potential prey or stress markers. The example I always give here is if you're a small pack of, say, 4 or 6 wolves, and you're going after a moose in 5 feet of snow, you may want to know if that moose is going to collapse within an hour versus 24 hours. In which case, if it's 24 hours, maybe it's time to go look for rabbits or something else, right? Okay. So the idea here is that I think there's probably an innate, in place predisposition for carnivores, specifically from wolves, to detect hypoglycemia, because that's often a sign of exhaustion, and detect stress as well, because that is really rich information to have if you're after a big prey. So in other words, we're kind of taking advantage of something that they can innately do. They need help still through training, but that's kind of the idea.
Right. That's like the theory behind it, why it might exist. Okay. And that makes sense. Can you talk a little bit, you mentioned 3 categories of individual human odors in your paper: the primary, secondary, tertiary, the volatile organic compounds. Just kind of give our listeners an idea of what these dogs are scenting or smelling. Whoever wants to just jump in.
Sure. Well, every individual person has their own volatile organic compound scent profile. The scent profile consists of various compounds. Some of them are, determined by factors that do not change much, like our sex, genetics. Others are determined by factors that change in time or day by day, like our diet, health conditions, at least some of them. And then there are factors like external factors that add to the volatile organic compound scent profile, like hygiene products or makeup, perfume, all of those things. And then so dogs can, first of all, they can discriminate between the scent profiles of different people. But what we are interested in our work line is whether they can detect the distinct biomarkers or volatiles associated with a certain medical condition. And in our study, it was associated, it was the stress volatiles associated with upcoming symptoms of PTSD, intrusion and hyperarousal symptoms, that is.
Right. So like, to give our listeners an example of someone might be fine, and then they start to, something triggers them, like some sort of, okay. And that's what you want the dog to detect, that,
yes,
which Simon said, that difference, that alert. Okay.
So it could be a panic attack, it could be a flashback, it could be a nightmare, any clinical arousal that could affect the person with PTSD, and we wanted to see if the dogs can detect it by their breath, which was the samples we used.
I don't know if you all looked into this, but does that change in scent? Would that happen before someone starts to show, the physical agitation, maybe, or the tossing and the turning? Does that happen first?
So yes, that's what our study, the theory, was based on. Depends on the stress mechanisms, but the SAM-axis stress response, meaning that the catecholamines, adrenaline, noradrenaline. So this response can happen before the person themselves is, first of all, before they're aware of it. And you would get those volatiles through the pulmonary pathway or through breath earlier than behavioral or physical cues manifest.
And what's interesting here is that, if you look at this literature right now, or the groups that do this kind of work, there's even a local group here now that's doing it, not with PTSD specifically, but with people that experience some stress. They all focus on cortisol. which is really interesting. So one thing I didn't mention before is the work I was doing with wolves actually was looking at their socioendocrinology. So I was actually working on hormones and how they modulate their social and sexual behavior. So I know the endocrine system fairly well. And one thing that always bothered me about this is that the HPA axis, the axis that is responsible for this important stress hormone we have in humans that we call cortisol, is slow. It's a slow system, right? Because there's many different steps. I won't get into the details of that here. But the SAM axis that Laura just mentioned is based on the very quick, rapid response of the autonomic nervous system. It's literally within technically milliseconds that that system is activated. But it takes a little while for this to get, because it will be in your bloodstream right away, but before it gets in the lungs. But fortunately, the lungs are highly vascularized, right? This is why we chose breath as opposed to sweat, for instance, because we know that it will get there. If there are any important volatiles, they will get there quicker than, by sweating, or some people use spit. But by the time any kind of metabolite associated with catecholamines are in spit, we're talking minutes, So if the dogs are indeed doing this early detection, so early that sometimes, as Laura mentioned, the PTSD sufferers will say, the dog knows before I do. It has to be a fast system. So I'm not saying the HPA axis is not kicking in eventually, but for the actual relevant detection, it's most likely, at least for most dogs, we hope the SAM axis that would be behind it.
That's amazing. And could you just stress to our listeners, we all know dogs have a better sense of smell, but kind of just how much better it is than us, than humans, whoever?
There was a very big range of how many times it can be better. Simon, do you remember the range? Up to 10,000 times better or something like that?
It's interesting. Everybody always wants information about this. We're literally talking about parts per trillion. I forget what humans can do here, but in humans it's much less than this. In fact, among mammals, there's a few mammals that are worse than us, but not that many. Cetaceans like whales and dolphins are not great either with olfaction for obvious reasons. Although I say that it's not that obvious, sorry, because fish have amazing olfaction. So it's not because you're in water that you don't have olfaction, because olfaction is something that can happen in a fluid, right? So air is a fluid, but water is a fluid as well. But cetaceans, like whales and dolphins, are not particularly, there's nothing, but it's very little. In primates, it's okay, but in humans, it's particularly bad. I've literally lost the ability of smelling compared to other species. Now, in humans, the detection is not as bad as people think. Where we're not good at is really what we call the speed accuracy trade-off in olfactory psychophysics. And what this means is we're not quick at it. So I'm referring back here to a study a number of years ago that was done with humans, where a chocolate, if I remember well, smell trail was put on a football field, and people asked dogs and humans to follow the trail. And they showed that humans can do it as well as dogs. Okay, fine. What they don't tell you is dogs can actually run that trail in literally 2 minutes when it takes 20 minutes to a human. Right? So what kind of accuracy are we talking about here, right? So that's a speed trade-off thing. So, our sensitivity may not be as bad as we think, but, if you look at all the factors, dogs are way superior. And there is a fundamental difference in what we would call here the detectability. So we don't have the numbers for you, but Laura is right. The range differential is huge. Oh, you have it.
I have the number now. I found it.
Okay.
And the range is huge. It's 10,000 to 100,000 times superior to humans.
There you go.
That's
so if it tells anything.
I was joking with a couple of people the other day, like, what your scent is to your, I have a dog, and, I've always had a dog, but what you smell like to your dog. And it was kind of fun to think for people to think about. So, and just to emphasize for our listeners, right now, you talked about psychiatric service dogs in your paper in the introduction or in the discussion. And right now, those dogs are trained to pick up on physical movements. And they're not doing anything with smell out there yet,
But
as far as we know.
no,
Okay.
some people claim they do. There's even
Oh.
a company that produces, actually, I don't have the details of that. This is a local person that is using this now, some kind of cortisol. He calls it cortisol, literally. I don't know what it is. And again, right there, I'm having some, I mean, sure you can extract cortisol, but that by the time, again, it's metabolized, gets in your lungs, that would be not pure cortisol. So I just don't know that, let's put it this way. It's not simple, but no, there are people claiming that they do it from the smell. There's different ways to do this. Some people have used sweat. Some people have used saliva, but you see, and this is where we're going next, is now that we know they can tell the difference between somebody that is stressed and that same person in a different state. The next step is to figure out what is the volatile. So the next project that I have funded is with Dr. Sue Budge. And with Suzanne, what we'll do is try to identify those volatiles that we think and hope will be associated with the SAM axis again. So adrenaline, noradrenaline, but we don't know that.
Right. Okay.
And one little thing that Laura can tell you a little bit more about is that, interestingly, we started with 25 dogs. We ended with 2. But there may be an interesting difference between the 2 dogs that finished the project in terms of what they're detecting, which is fascinating in itself, because that suggests that it may not be the same thing for every dog.
All right, so let's talk about the human volunteers. And can you tell our listeners how you collected the breath samples and I suppose divided them into baseline versus the breath samples after exposed to some sort of trauma cue?
Yes. So we didn't expose them to trauma, but trauma cue, yes. Anyhow, we collaborated with another lab at Dalhousie that did psychiatry and clinical psychology research. And they recruited 26 human participants with trauma histories. Over 54% had confirmed PTSD. And those people participated in 2 different sessions in separate days. One was a session where they talked about their personal trauma in detail. And another was an MRI session where they went to the MRI scanner and they were presented audiovisual cues and textual cues of their personal trauma. So it was an induced stress response, and we collected face masks that the participants were using in both of those sessions. So these face masks that they wore during either the interview or the MRI scanning session were what we would call the trauma cue samples. And then we also collected face masks that they wore before those sessions. So either during signing consent forms or when they entered the hospital and prepared to go to the MRI scanner. So we use those first face masks as baselines, because we assumed that the person was in relatively calm state compared to at least the trauma cue.
And the trauma cues were individualized to each person's individual.
Personal trauma. Yeah.
Okay. That was just one question I had, because I know it is really individualized, right? What can trigger someone. So how did you train? Then you went to train the dogs, right? To know the difference. Can you tell us a little bit about that?
Sure. Well, first we trained the dogs to do the scent detection tasks. We didn't use participant samples at that phase. We just taught them to pay attention to minute changes in different odors and to signal the target odor, etc. Basically to perform the tasks. And then we started training them with the actual human samples. It took some time, but eventually They learned it. They learned what we want them to signal, which would be the stress sample.
And you knew that they learned it because they would hover over the target, kind of just so our listeners know, like, well, how do you know the dog learned the difference?
So we train the dog to signal the target odor. So in the first experiment, the dog would be presented with two samples, two samples of the same person. So the baseline sample and the trauma cube, stressed sample. And the dog would have to show us which one is the trauma cue sample. And the way we trained the dog to signal that was to hold their nose on the sample container for 5 seconds. And in the second experiment, that was a bit different setup. It was a detection task. So the dog was presented with one sample at the time. It was a pool of different people's samples. So it could be a trauma sample, it could be a baseline sample, and then it would be followed by different people's trauma or baseline samples. Anyway, the dog was presented with one sample at the time, and it had to give an answer to every sample, telling us that yes, it is a stressed sample, which means that the dog again would hold their nose on the sample container for 5 seconds, or the dog would have to tell us that no, this is not a stress sample. This is the baseline sample. And the response for that was to sit.
To sit. Okay. And the dogs that ultimately participated or that you recruited, were they just dogs from the community? Like I could bring my dog in, for example? Or
Yeah.
Okay.
Yeah. So these were, we recruited regular companion dogs, and we trained them in the lab.
Did you have an age range or anything? Did they, or breed specific or nothing? Just a dog?
They had to be adult and also not too old, but no particular age limit other than being in the adulthood, and no, we didn't discriminate or limit the breed selection either, really. So we experimented with different breeds, but in the end, the most successful dogs were working line breeds. So one was a golden retriever, but from a working line heritage, and another one, Callie, was a mix between a German Shepherd and Belgian Malinois, and both parents were from working line heritage. So,
and not all, because not all the dogs made the cut, I guess.
No.
Okay. So
I have to.
Go
sorry,
ahead.
I was going to say Laura kind of broke the pattern here for us, because when you put advertisement out there and say, hey, do you want your dog to participate in a study? And by the way, this is not just one visit. This could be years sometimes of participating in our research. What you typically get is people showing up at your lab with border collies. And the reason for this is, please find a job for this dog. There's a few other breeds that would keep coming back. But Laura was, I don't know, it's less, let's say, anyway, maybe less influenced by the breed, or somehow the pattern broke, because we ended up having a lot less border collies, although we had a few. And the two finalists were not. And interestingly, actually, we had horrible success with the German Shepherds in the past. Now, the Malinois part probably really helped with Callie, but German Shepherds have not been good for us. In fact, I think she's the only ever German Shepherd or German Shepherd cross that has made it to any of our studies, in fact. Yeah.
Callie, and what was the other one's name?
Ivy.
Callie and Ivy. Yeah. So two female dogs?
Yeah.
That's right.
Okay. All right. So I think you all set the stage for our listeners. Can you talk a little bit about the results, from your experiments? What did you discover?
Sure. So the results of the first experiment showed that both Ivy and Callie were able to discriminate between the human participants' trauma cue and baseline breath samples. And both of them did a wonderful job, had a very similar, close to 90% accuracy. What was not expected was that out of the 40, so we had 40 sample sets from 40 different stressful situations. And out of the 40 sample sets, both dogs had 4 that they couldn't discriminate, but only 1 in common, meaning that there were 3 samples that one dog could not tell apart and the other dog could do very well with. And when we looked at the correlations with human participant outcome measures, including their negative affect and its different items, like for instance how upset you are, how irritable you are, how afraid you are or scared, we noticed that they had different correlations. So Ivy had correlations with basically the human participants' anxiety. And Callie had only one correlation with, out of the measures that we actually measured, we didn't measure everything. So she had a correlation with the human participants' shame response. And just looking into the literature, we saw that, well, there's a robust association between anxiety and SAM axis stress response. So we assumed or speculated that Ivy was probably more attuned to the SAM axis volatiles, including adrenaline, noradrenaline. But the literature also showed that shame response there's some link between cortisol and shame response. So we were thinking that maybe Callie was attuned to the HPA axis volatiles.
And to put that in kind of like plain language, it's like when people feel shame and the dog was able to detect. Go ahead.
So we speculate that Callie was just detecting the cortisol response or glucocorticoid response,
and they were feeling shame.
Well, we didn't. It doesn't mean necessarily that she knew that the person was feeling ashamed.
Right.
It's just that we didn't really have any other measures that would indicate cortisol response. We didn't have physiological measures, for instance. We didn't measure salivary cortisol. So
that's interesting. It's associated cortisol with shame.
Yeah, well,
that's the first time I'm hearing it. It's just interesting.
That's right. So yes, there's some literature on that shame might be associated with cortisol response.
Which makes sense, but usually you just associate it with just stress.
Well, shame is a stressful situation.
Yes,
emotion. So
it is. It's just funny I think it's just hearing it, like it's associated with shame, and it's a stress response. But yeah. So was there anything that you were surprised by or that was really unexpected, or pretty much everything, that you hypothesized was met?
I think the most surprising was exactly the fact that the dogs were detecting most likely different volatiles.
Yeah.
Volatiles from different stress systems. So in Ivy's case, the SAM axis system, and in Callie's case, probably the HPA axis system. But it was unexpected, but it was a very cool result.
Yeah. Just like all dogs are just a little different, maybe.
Yeah, and recent studies have there hasn't been many, but there have been some studies that have shown that dogs can detect human stress samples and discriminate them from baseline samples, but no study had showed that they might detect different stressful.
So you're the first study to show that.
Yes.
Nice. Good to be a first, right?
Right.
Simon, did you want to add anything?
No, I have to say I've learned a lot from the clinical / personality in a sense measures, because I mean this whole guilt shame thing has a lot to do with the individuals. I've learned a lot in terms of how it's actually attached to PTSD very specifically in some cases. And it's a bit mysterious to us. We kind of implicitly pointed out a few things we can do more of or better in the future. Well, for one, identifying the volatiles, but also having physiological measures from the human participants may be very good, just to confirm that they are in the state we think they're in. Because right now it's based on self-report, essentially, which is technically, good enough in the sense that I think we have to trust if they say I'm stressed and I'm panicking, that indeed they are.
Yeah.
It's not just it's perception is all that matters here, right? In a
Totally.
sense.
Sure.
For somebody with PTSD, obviously. But for the dogs, I expect a high correlation here between what people report, their physiological state, and what the dogs can detect. If we don't find that, then we're in trouble. But it just makes sense that all of this would converge.
Oh yeah, and I'm sure there's overlap too, just thinking about the different ways PTSD can manifest for people, right? It's varied. It's varied. And
Absolutely.
Even with the rat literature, right? Even with the animal models we know that all kinds of ways it can manifest itself. You did mention earlier the visual cues. The advantage of our study is that we took that out of the equation, right? Because it's done in vitro, not in vivo. So the dogs never see the person that they are sniffing, which means that none of those cues are present. But it also means that, when you do it in vivo, obviously, unless the dog is blind, that there's added cues that can be used by the dog. So one of the things at one point that did interest us a little bit, but we don't have tons of data on this, was the incidental observation that some people during trauma cue exposure were fidgeting. Right. But not everybody, not all, it's very idiosyncratic, and that's fascinating in itself. But you can imagine if there's a motor response that obviously dogs would notice it, right? So it's not just
also that symptoms wise, people have different PTSD symptoms. Some have those intrusion and hyperarousal symptoms as the main or the predominant symptom cluster, while others have more of the cognitions and mood symptoms, which shame is one of. So yeah, that's interesting too, that the dogs would show that in a sense.
There's another really interesting thing in this literature, and this is from the endocrinological literature that I've been following for a few decades now. Like depression in PTSD, you cannot assume much in terms of the endocrinological reaction. What I mean by this is this. There's about 50% of people with depression or PTSD that have a strong HB axis response. The other 50%, it's dysregulated. In some cases, it's completely, I wouldn't say absent, but it's really weak response. So that in itself is interesting, because that means with these people, dogs, if they were to rely on the HB axis and cortisol, may not be able to be as accurate, at least, as the dogs that, will detect what's associated with panic attacks and anxiety attacks, which again, we think is the SAM axis. So it's very complex. It's very multifactorial, all of this. There's so much more that can be done to try to investigate what's going on.
Okay, so I'm going to ask you, what is the next steps? How are you going to build upon this research-wise? And then I'll ask you kind of like a big picture question, how you may one day see this applied in the real world. So I guess next steps in terms of how you build upon this research, what would that be? Whoever wants to go.
Next step would be, well, right now is to try to see if we can detect some of the volatiles associated with the tasks for the human subjects. Maybe correlate this with performance markers with the dogs. But that's not the only thing we want to do. But this is literally what some people think we should have started with. But the problem is that we didn't see any point in doing this until we know that the dogs can tell the difference between stress state versus not. Now that we know they can do it, now let's go and hunt for those volatiles. But what's really interesting here is that Suzanne Budge, my colleague, our chemist, thinks that actually it's quite possible that the current technology, which is basically mass spectrography and gas chromatography, may actually not be able to detect what dogs can detect. Again, if you look at the data, when we're talking about parts per trillion, there's suggestion that the dogs could be superior to the current technology. So,
wow, that's
who knows?
interesting.
We may be out of luck here completely. It's going to be interesting to see. But so that's the first step. The other step, I think, in this biomedical stuff, and we saw this with the hypoglycemia project, technology moves quickly. And my prediction is for a lot of the diagnostic stuff and the biomedical alert, what we call electronic noses may play a role, not take over fully, because one thing that I will let Laura develop on is that it's not just detection or alert they do, right? They are also, in most cases anyway, assistance dogs. They're there to have a different function. They're not just alert. Oh, wait a minute, something's coming up. It's much more than that. But that part of it may eventually go towards portable electronic noses that would be able to say, oh, maybe there's a panic attack coming. But the assistance dog part is so important. So I'll let Laura develop on that.
Okay, that makes sense. So like identify what the volatile compounds are and then sort of replicate that in this artificial nose is what you're saying.
Yeah, well, that's not my lab. That will be somebody else that
Someone
will do
else's,
this.
yeah.
It's a big industry. Although part of the use here of identifying, obviously, the correct,
if you can,
volatiles, if we can, it would be to help training of those dogs. If you know exactly what they're smelling,
right,
what they're identifying, then it speeds up the training.
Yeah. Right. Laura?
Yes, so I can talk a little bit about the practical implications of the study. So yes, as Simone mentioned, you can't really replace a PTSD service dog with an electronic nose because the PTSD service dog has so many more functions. For instance, not just alerting to the upcoming episode of distress, but also comforting the person during it and offering distraction. And then other trained tasks of PTSD service dogs, like the positional commands, block and cover, that help increase the sense of safety in the person, retrieving objects, other tasks that are trained, but also just dogs' untrained characteristics, like the perceived unconditional love, that the dogs are non-judgmental. All those factors help the person with PTSD. So yes, an electronic nose is not gonna outperform dogs. So I really don't think that. But how our study per se contributes to PTSD service dogs is that I hope at least it offers reason to investigate whether training PTSD service dogs to rely on their olfaction when alerting to episodes of distress, whether it can make this function more effective, as in the dogs interrupt and alert earlier than they would when they would rely on behavioral and physical cues. So that might, at least it has a potential to prevent the episode from escalating. And in one way, well, first the dog will distract, but also the dog will remind the patient earlier to use the skills learned in therapy, which might be more effective thanks to the earlier reminder.
Right, and that totally makes sense. Just intervening earlier, I think, could have huge benefits, really, depending on what that person's response is, but that could be actually life-saving. I'm just thinking of some, the veteran population, like that could be life-saving. I have to tell you, I had a researcher on here from Washington State, and she was doing where dogs would find the scent of Parkinson's. And I remember, and they had like one group of folks who were diagnosed with Parkinson's and the other people who weren't. And then this one dog, I guess, gave a positive sign to someone in the control group, like, actually you have Parkinson's. And the people were like, no. But then a couple months later, something like that, the person actually, it might've been longer than that, but the person was actually diagnosed with Parkinson's, and the dog picked him out of the control group. And I just remember that story because like, the dog was like way ahead of everybody else.
Wow.
Yeah.
The first, I think the first study done on this was in Great Britain a good 7 years ago, I think. And what's interesting, it started with this very strange case of a woman that was claiming in the UK she could smell Parkinson's.
Yes.
And
yes.
this is when I remember my email was buzzing, like you wouldn't believe, people saying, hey, this is the next thing to do. And I think it's Claire Guest's group in the UK that first looked at this. But yeah, that's really interesting.
Yeah.
And it's unclear to me, although I can't say I can claim I know much about Parkinson's here, what would be distinctive. But this idea, by the way, that organisms smell differently when they have a disease of some kind is, again, this is not totally new, right? We know that animals, mammals at least, seem to be able to identify sickness in others, indication that probably by smell as well. And it would make sense, right? It's often a metabolic endocrine reaction or immune system reaction to something. If you look at human biochemistry and physiology, the fact that some of these things could have a distinctive, odor profile, yeah, absolutely. So we may not have scratched the surface even yet in terms of what dogs can do there.
Yeah. And I remember anecdotally, there was a story on social media about a cat at a nursing home who would kind of curl up to a person who was just about to die.
There's a book written on that cat, actually. Don't we have it in the lab? I think we have it in the lab. But yeah, no, it's a fascinating.
But that's probably something similar too, right? I assumed it must be smelling something.
Yeah, if I remember, that's the cat that was literally just before the person would die, right?
Yes.
I think.
Yes.
Yeah, that's right. That's crazy. But again, is it that surprising? I don't know. I mean, if you have fantastic olfaction, and if you think about the process of dying, for instance, there's a lot of alarm signals that are going on in the body, most likely in the hour that precede death. And you could see that, that's something that's detectable. And again, if you think about a carnivore, a predator, it would make sense, right? That you would be able to detect, especially if you're trying to immobilize a prey. If you look at lions, when they try to suffocate a zebra, for instance, is this going to take me 1 minute or 15 minutes of a battle, literally? So this idea, again, is that this would be adaptive. It makes sense to me as a biologist, as an ethologist, that this is something that just makes sense, that some animals could do this accurately.
Of course, I think some people would want, if like my dog curls up to me if I'm about to die, I would want it to be because he's like saying it goodbye. Maybe that's, that's like the human in me versus, oh, this is prey about to die.
That may actually explain that study, that interesting study where they tried to see if the dog have empathy, and people would pretend to faint or collapse, and dogs would literally ignore it.
Yes.
And the first thought, most dogs anyway, my first thought was, they know there's nothing wrong.
Yeah,
right?
and that's hilarious because
if you collapse and there's actually something going
wrong.
On, then they would detect the volatiles.
Well, that's when I joked, people would come, oh, my dog can play dead. And I always said, yeah, but I would want to know what my dog does if I play dead. But you're right. And I actually would pretend and just being goofing around and fall on the floor, and my dog would do absolutely nothing. Just absolutely nothing. Anyhow, thank you both for your time. This was very interesting, and I look forward to sharing it with my listeners and getting their feedback on it. So thank you for joining in on the podcast.
Thank you for inviting us.
All right. Enjoy the rest of your day in your respective countries. All right. Bye-bye.
Okay, take care.
Bye-bye.
Bye.
Thank you, everyone, for joining in. Please let me know what you thought of the podcast. As always, you can email me at erin@bloomingwellness.com or find me on X, formerly known as Twitter, Instagram, TikTok, Facebook, and YouTube. I think I hit them all, right? There's so many, I can't keep up. And if you like the Causes or Cures podcast or get value from it, please consider subscribing and you will help it stay alive because it is a lot of work. It's fun, but it's a lot of work. And if there's any, guests or topics that you want me to bring on, just email me because I always try to do that. If a listener messages me and says, hey, can you talk about this topic? I always do my homework and I try to find a guest who, is knowledgeable and an expert, not a quack, and bring them on the show so you can hear directly from them. Okay. And now it's time for the closing quote. This one is from Mary Oliver. A dog can never tell you what she or he knows from the smells of the world, but watching them, that you know almost nothing. Oh man, I love that. Maybe that's why dogs are so happy because they know something we don't. All right. Hope you tune in next time and goodbye for now.